Right, we're going to make a start, everyone. Good morning. It's a pleasure to be here. I cannot see you, but hopefully you can see me. This is Christine, Chair of the Forum here. Welcome to our first ever webinar, jointly organised by Enfield's Older People's Partnership and Enfield Over 50s Forum. And our theme today is challenges to services and the support that's important to older people in Enfield. This webinar has been managed by the Enfield Over 50s Forum, and I'll be honest, we've all got everything crossed, including our fingers this morning. We're absolutely delighted that 100 people are likely to log in at some point. We've already got 60 of you online at the moment. And we can't see you, but we hope that you can see and hear us. I'd like to start with a particular welcome to our three panellists. This morning, as you know, because you've all received, hopefully you've received Tony's missive, we are welcoming three very important people in the world of pensions and health. Jan Shortt, who is the General Secretary of the National Pensioners Convention. Deborah McBeal is Enfield Director of Integration for the NHS Central London Clinical Commissioning Group. And Bindi Nagra is Director of Health and Adult Social Care in Enfield. We're absolutely honoured and delighted to have three panellists of such stature joining us, and let's hope it goes as well as we hope it will. So that's our welcome. We're also going to be joined by Jon Newton, who is Head of Older People Services and Physical Disabilities for Enfield, and he's going to kick off in a little while by telling us a bit about the role of the Older People's Partnership Board. Just a few points to make to you. You will have an opportunity to ask questions of each panellist after their address. So, and your questions hopefully will relate to what they've talked about. We're also, if you type your questions into the chat facility, which you can see on your screen, if you just click on your screen, you'll see chat will come up. You can put in a message in chat and we will attempt to relay those questions to our panellists. And then finally, at the end of the meeting, there'll be an opportunity for more general questions or for things that perhaps we need to go back to, that we've got hopefully a 20-minute slot at the end where we can ask a few more questions. So without further ado, I am going to introduce Jon Newton. He's going to talk about just a few words about the role of Older People's Partnership Board. Jon won't be taking any questions at this time, but he will be around for the final session. So if you've got any questions for Jon, if you could save them to the end, that would be great. So Jon, over to you.
Thank you, Christine. I'm going to share a couple of slides just to, oh, hold on. The host disabled participant screen sharing, so I can't share any slides.
Oh.
I'll be able to undo that. Otherwise, I can just talk to what I need to talk to.
Tony, can you undo that?
So while Tony looks into that, as Christine said, I'm the Head of Older People and Physical Disability for Enfield Council. I've been in the role for about 4 years, and I'm a chair of the Older People's Partnership Board. Basically, the Older People's Partnership Board is a group of organisations, individuals who come together on a quarterly basis to promote integration, prevention and partnership working and address the strategic issues concerning older people in Enfield. So we look at bring people together, representatives, the public, voluntary community sectors to improve public services to older people in the borough. So we share information and best practice and ensure that people, older people at the heart of what we try and do in some of our activities within the council and within the wider partnership. So the number of organisations who are part of the partnership board, and a lot of detail, a lot of time goes into the partnership board to ensure that we're able to continue our work. So we've looked at certain themes within the partnership board. So the recent theme we've been looking at a lot about is about loneliness and the impact that loneliness has on individuals. Whether you may well have connections, but you might still feel lonely. And a lot of partnership board work has been trying to ensure that we're able to develop or to run events that support people with that, to try and find and support people in the community. Now, loneliness is a very difficult subject for many people because it's hard to find. People can be active parts of their community but still feel lonely. Some people can be hidden. It's about finding how we support those sorts of people. So what we've done in the past is we've run up certain events. We had what we call a Friendship Matters event a couple of years ago, where we held an event at the Dovedale Centre with lots of different activities going on, lots of different speakers, trying to find out how we could support better people. So we've got some good information out of that. And then we take that back to the partnership board and discuss that with our partners and work about how we can then support further activities. Now, that's been for the last 18 months or so, and obviously COVID has had a big impact on that because, as today is evident, we're now talking to each other via video and webinars rather than in face-to-face or having meetings. So we would have ordinarily been trying to organise something for Older People's Day, which was on the 1st of October, as we did with the Friendship Matters event. So we try and tie in a theme alongside the event. We haven't managed to do that, but today we've got a number of speakers to talk about issues that are pertinent to the partnership board. So just very quickly, just to summarise, so the partners we've got involved are people like Age UK, we've got the Carer Centre involved, Health Watch, Northland Hospice, very important with Over 50s Forum. Tony does a fantastic amount of work getting people's views and advice, and as others do. We have Ruth Wilson Centre, we've got people from Enfield Racial Equalities Council and Asian Welfare Association, and then we've got the health and social care input. So we have the council, we have NHS CCG, and we also have people like North Middlesex Hospital. We have occasional speakers that come and talk to us about impacts of certain changes within the NHS, and Deborah's going to go on and talk about that. But if anyone's got any questions, we're about to pick those up at the end. Okay, thank you, Christine. That's a very quick run through.
Thank you very much, John. That was a quick run through, but it gave us a lot of information, so thank you. And as I said, and as John said, if you do have any questions for John, he'll be around at the end of the session. So I hope that you'll save your questions for then. Thanks very much, John. Now, Jan Shortt is next on our list. Hello, Jan. Good morning.
Good morning, Christine.
It's lovely to have you with us. And Jan is, I've already introduced Jan. She's General Secretary of the National Pensioners Convention, which I believe is the biggest organisation of its type. Is that right, in the country?
It's the largest campaigning organisation across the UK, all 4 nations.
Great, thank you. And Jan's going to be talking about pensions and the triple lock, and I'll just hand over to Jan. Welcome, Jan.
Thank you very much, Christine. It's lovely to be here. It would obviously be much better if we could be in the same room and have the laughs and conversations we normally do before and after meetings. But congratulations on getting your first Zoom up and running. We did the same on the 1st of October, and it was quite stressful, I say. So I understand where you're coming from. Right. Pensions, triple lock and universal entitlements, which is what I've been asked to talk about, and how we can campaign on those. Well, the triple lock is in place for another year, but we haven't got to be complacent, and we've not to lose focus on that, because there will still be the think tanks and media attacks throughout the next year or so. So the triple lock is in place because the basic state pension is the most inadequate in the economic developed world. And it's already had its value decreased through government decisions to apply CPI instead of RPI as the index. And that's happened over a couple of years. So the decrease in the actual value of the triple lock has already happened, and it will happen again in the future, given what government are looking at. Other universal entitlements, like, for instance, the triple lock, the TV license, which of course we're not here to discuss today, but it has been means tested. And I'll come on to how that has impacted or will impact on certain areas of population of the pensioners. The winter fuel allowance, the bus pass, they've all been mentioned as something that's not affordable in the current climate. But the campaign for the TV licence is not over. I'm meeting with Tim Davey, the Director General of BBC, later this month, and I will give him a very hard time, I promise you. But if we take the 75 plus age group as the most vulnerable to reductions or losses in universal entitlements, we know that current poverty levels stand at 18.5% compared to 11% amongst the whole of the rest of the population. And within this age group, women are most affected by poverty. So because of the means testing of the TV licence, and this is why it's really important, we estimate around a further 55,000 individuals over 75s falling below the poverty line just by having to pay for their TV licence. So the triple lock is extremely important to those people. So what we do know is the triple lock was always going to be reviewed in 2022, along with other parts of the pension system. So we have got to be prepared to argue our corner between now and then, as we see further mentions of a double lock become more prevalent in the media. A double lock would mean the basic state pension increasing by the higher of earnings or inflation. So the bit of the triple lock that will be missing is the 2.5%. That's quite a lot to lose. Yeah. So it's really, really important that we gather our armour, so to speak, and get on with the campaigning. But there's already an unfairness between what is termed the basic pension scheme, which is the old scheme that people who retired before 2016 are on, including myself, and the new single tier scheme, which started in 2016 in April. And that was promoted as equalising pensions for all. It does nothing of the kind. In fact, currently the gap grows each year because the old scheme is only triple locked on the basic element of your pension, whereas the new single tier scheme has all of its, the whole total of it, triple locked. Currently, the difference is around £40 a week. That's a lot of money, yeah? And over time it will grow because the system won't change unless we try to change it. It also means that those people who've worked longer, say over 40 years, and we know of some individuals who've worked around 50 years, will get a pension based on only 35 years contributions, not the contributions made over their lifetime of work. So there's an amount of money there that we are looking to find out what happens to that. Because if you've paid in, you need to remember this is a contributory scheme, and people were told they would get in what they would get out what they paid in. Now, women like myself didn't pay in and didn't enough to get a full pension, but there will be those that have got over 35 years who should have those contributions repaid to them, but it's not, it's going to the Treasury. Now, the role of the state pension is not really clearly defined. So in the first instance, when it came into being, it was intended to provide a basic income. Then through time, it became about maintaining living standards. And now it's back to being a basic level of income. So from the MPC point of view, that being the case, then it is a poor basic income for older people. The old basic state pension has a replacement value of 29%, which you think is, really low, and it is low compared to other countries like Austria, who give 63%. But the new pension scheme, so those retiring after us and coming along after us, their replacement value will be just 24%. And that is why there's a government initiative to get workers to top up their pension pot and put savings through an auto-enrolment scheme. So here again, in the auto-enrolment scheme, there's inequality because it's not a universal scheme. For many lower paid workers, they can't access it, so therefore have no way of topping up their pension. So if we assume that poverty grows with earnings, by 2050, the proportion of pensioners in poverty under a double lock that I've just explained would increase by around 4% when compared to if the triple lock was still in place. So again, another reason why we have to fight hard to retain the triple lock, because you can always see the downward trend. Yeah. And there are many anomalies in the pension scheme, some of which I've already said, but the gender pension gap is one which the MPC must work on to improve the outcomes for women. The research that MPC carried out in 2019 and produced the report Understanding Women and Pensions, we found that women workers clearly suffer from generally having low wages and therefore lower pension contributions. Breaks in national insurance or pension contributions due to care and responsibilities or insecure part-time employment. But the reality is that if you are low paid, you will have a poor pension in retirement. Married women, we found, were the poorest in terms of personal income. Private pension scheme membership and accrued savings vary widely according to occupational class, employed hours, ethnicity, and all intersecting with gender. So the gender pension gap is bigger than the gender pay gap. It stands at 39.5%, twice as large as the difference in pay in the workplace. So again, another huge area to work on. A recent report by the Women's Budget Group in March 2020, it continues to give us case for concern for the future. What it shows is among those aged 60 to 64, nearly 2/3 of women have no private pension wealth. The gender differential in private pension wealth is substantial over the age of 65. So if you look at among 65 to 74-year-olds, median private pension wealth is £164,700 for men and only £17,300 for women. So that's just slightly over 10% of the total private pension wealth of men. In working age women, currently only 36% of women contribute to a non-state pension, whilst the figure for men is 48%. So if current trends continue, then women and lower paid men may find themselves heavily reliant on a basic state pension that is inadequate, to say the least. And we should also recognise that there is unfairness between the female generations caused by the new state pension which Steve Webb introduced in 2016. Like, for example, 2 case studies: a woman born on the 6th of March 1953 with 35 years worth of national insurance and contracted in to the state pension, second state pension, reached state pension age on the 6th of March 2016 and qualified at that time for a basic state pension of £119.30 a week and an average second state pension of £28, which makes a total of £147.30 a week. However, a woman born on the 6th of May 1953 with 35 years worth of national insurance and contracted into the state second pension reached state pension age on the 6th of November 2016 and qualified for a total state pension of £156.63 a week, over £8 a week more. So the unfairness is 2 individuals with the same set of circumstances, but for being born 2 months apart, receive different levels of state pension. Now, Steve Webb has since apologised for this anomaly and has admitted that it is not the single tier pension that he promoted and that he thought was going to be introduced, which would be fair for every individual. Now, to our reckoning, the pension system is out of date. At its inception, it was a system built for men by men, and a system that in the 21st century is not really fit for purpose. Now, the NPC policy on pensions is a basic state pension set above poverty level at 75% of the national living wage, indexed by the triple lock for everyone, every single individual. And some call it a citizen's pension. That might be a better way of describing it. But today that would provide around £230, £240 a week for every single pensioner, which raises the ante for women and for lower paid men. And then we have the matter of frozen pensions. I mean, there's 550,000 British pensioners currently living abroad who are adversely affected by the government's frozen pension policy. This means that those living in their retirement years abroad do not receive an annual inflationary uprating, which in reality means their state pension decreases in value year on year. This system leaves many British citizens living in poverty and without independence in later life. So if you look at an example that we've seen of a lady who, when she left the UK to go and care for her mother, her pension was £49 a week. It's still £49 a week. Can you imagine how she struggles to manage on that amount with no extra top-ups? So due to the increasingly outdated bilateral agreements made with some countries and not others, British pensioners living in retirement overseas are not treated equally. And the discriminatory nature of the system impacts on the choices that Britain's Black, Asian and minority ethnic communities will have. And many from these communities came to Britain to work in the 50s, 60s and 70s. They've worked and contributed all their time in the UK. And there are many reasons for leaving the UK. Ill health of a family abroad, requiring someone to care and look after them. Ill health of the individual, returning home in order to receive care from their family. Reaching an older age and returning to their cultural home to live out the rest of their life. Regaining a sense of belonging in the country. Now, the NPC wrote to the all-party parliamentary group dealing with frozen pensions, supporting two solutions that could be applied in the short and longer term. The short term is partial uprating, and this would involve introducing triple lock uprating for those on frozen pensions going forward from the current rate received. The cost is less to the government than pension parity, but those on the lowest pension income would feel limited improvement due to their pensions being so low. There are savings to be made by government each time an individual moves abroad, and these should be used to offset the cost of ensuring that equality in pensions is restored to all 550,000 British pensioners living overseas. And currently, this is circa £4,300 per individual and is mainly in health costs. Pension parity, the longer term, this would give all 550,000 pensioners living abroad and subjected to frozen pension payments their full state pension entitlement as though they were living in the UK. The pension would then be uprated in line with UK pensions going forward. Inevitably, this has a cost to the government, which they seek to use as a reason why inequality should remain in place. However, it would treat all British pensioners the same according to the national insurance contributions, not their country of residence. It would also alleviate poverty, thereby restoring dignity and choice in later life. The all-party parliamentary group is engaging with the government on these two areas to try to get a definitive answer, something that has not been forthcoming from them in decades, which is not unusual. We're hearing across the world of difficulties caused to pension schemes through COVID-19, and we can expect the same in the UK in the run-up to 2022. In fact, as pointed out at the beginning, we're already being told pensioner benefits are unaffordable. The MPC wrote to Rishi Sunak, Chancellor of the Exchequer, Theresa Coffey, Secretary of State for Work and Pensions, and their shadow counterparts on the issue of continuing with the increase in state pension retirement age when so many young people had lost their income and livelihoods. We proposed that they suspend implementing the increase to 68, which would allow those who wish to retire to do so, and their jobs ring-fenced for a younger person needing work. Unsurprisingly, the only reply we got was from Jonathan Reynolds, Shadow Secretary of State for Work and Pensions, who supported our call and has offered to contact us when they look at it during their policy review. And let's not forget, older people are still contributing to the Treasury to the tune of £160 billion a year through direct and indirect taxation, unpaid caring, childcare and volunteering. The problem we have is that no matter how many times we say it, the think tanks and media do not mention the fact that there are two basic state pension schemes. They only talk about the post-2016 scheme, which allows the public to think that all pensioners get that rate of pension. The dialogue around older people has changed over the last 5 or 6 years. It used to be that when you retired, you were respected for the lifetime of work you'd done, the economic and social contribution you'd made to the country, and now is the time for you to take a well-earned rest and let someone else do the work. Now older people are seen as a drain on public resources, with no notion that we've done all the things the younger generation are doing and more, and still pay for what we get. It is a popular belief that a state pension is a benefit, not a right that is being paid for over our working lives. And we must work harder to change those perceptions of older people. And one of our major campaigns will be for a commissioner for older people in England with the same independent judicial role as those in Wales and Northern Ireland. It will give us a higher level profile, and there will be somebody of note, speaking up for older people. Now, there's a question I give to you. Here is a quote that a famous person made, and see if you can guess who it might be. There is nothing government can give you that it hasn't taken from you in the first instance. And that is so, so true. Thank you very much for listening.
Thank you, Joan. Thank you so much. You've actually made me quite depressed. I'm sorry about that, but thank you very much for sharing your views and your campaigning. It seems to me as though you've got another lifetime's work to do in order to protect us pensioners. And so thank you very much. I would like to ask if there are any questions from anyone. Remember, if you want a question, you simply type it into the chat. So any questions for Jan that you would like me to communicate to her? I'm sure she's all ready for action. It's all gone very quiet out there.
Well, I'll stay around if you like, Christine, because if people are, straight after people are digesting what I've said, and, in terms of other things, there is a question.
Okay,
from,
there may well be.
Dale. Yeah.
Right, we've got one question here, which is, what is the average pension and average pension age in Europe and the US?
Oh, that's a question and a half. Well, without looking at some detailed kind of research, I do know that the UK is just probably second in line for the highest retirement age. There are some Middle Eastern countries who have retirement ages set at 71, which obviously our government will progress to. In terms of basic state pension, obviously other European countries, because it's based on the GDP of the country concerned, the level at which the UK is paid is slightly in a different manner to others, because other countries, although they give a higher pension, a basic pension rate, they also pay a higher rate in contributions. So that's the fallout. But if I could just take that away, that question, and I will send the answer to Tony, and Tony can circulate it to everybody. So that's one question I wasn't really expecting. So yeah.
That would be great if you could send us that answer, because we can put that in our newsletter. Yeah, thank you. And we have another question. Could Jan explain again the difference between triple and double lock and the abbreviations she used about these locks? So a quick overview.
Yeah, the triple lock as it stands, every September, the government looks at inflation, and it takes into account the inflation by CPI, not RPI, yeah, which is the consumer price index against the retail price index. So if you look at the retail price index is, take an easy example, increases in train ticket prices. They're always looked at on the retail price index, not at consumer price index. Yeah. So the triple lock is the best of consumer price index, the earnings, so the percentage by which earnings have increased, and 2.5%. Yeah. The double lock will take into account CPI and earnings only. So the loss will be the 2.5%. So it's always the higher. So this year, earnings has come out higher. So we got the 2.5%, which was or just over 2.5%, was 3%, because earnings had increased by 3%. And that hasn't been the case for years and years and years. So normally 2.5% comes out at the highest level. So it's the higher of the triple lock, those three. And if they go to double lock, it will be the higher of those two, earnings or inflation at the rate of consumer price index, not retail price index. I hope that makes sense.
Thank you, Jan. And I think we've got time for one more question, which is, how does the government get away with penalising women for paying married women's stamps when we have the Equality Act? They used to advise women to do this.
Good question. When we produced that report, Understanding Women's Pensions, I did think that perhaps we ought to pursue, and I think we will do it, because we now have the women's budget team that's on board with a lot of women's issues. And I think we might be able to take that issue up with the Commission for Equalities and Human Rights, because it doesn't matter that you paid a small amount of money. And I can remember I paid the married women's stamp for a long time, yeah? And we were told that that would go towards your pension. But then when they took it away and we asked what where that was going, oh, well, when you pay your national insurance contributions, that goes towards it. And one of the things that I found quite, what can I say, humiliating in a way, was that I actually, because I don't have a full state pension because I stayed at home to look after my children, yeah. Nowadays, young women are far luckier. They will get an NI credit from the government for caring, whether that's for children or for, relatives or anything like that. But it's not so in our generation of women, Christine. So I got a letter from the Department of Work and Pensions saying, because I'd stayed at home for so long to look after my children, they were going to give me a home responsibility allowance attached to my pension. Oh, goody, says me. Right. Well, when I got the letter, it turned out to be 64p a week. So 32p a week per son. So that's what my value is as a mother. So I was completely humiliated, and plus I was angry. So I think it's right that we need to start work on the Equality Act and how it treats women. The gender pay gap is huge, and the government's not going to want to be dragged kicking and screaming into that arena, but we have to try. So I think our first port of call would be the Commission for Equality and Human Rights, and see what they say about it, and along with the Women's Budget Group, and perhaps those few MPs that do actually support, you know, women's rights in Parliament. And it is a human rights thing. It doesn't matter if you pay six old pennies a week for your pension, as small as it is, that does make some small contribution to what you get paid back. It's like, she's right, it's like we never existed. So I hope that's helpful.
Thank you, Jan. That's added another job to your list.
That's okay. We're used to it. We're used to it.
Thank you so much, Jan. And I know you're going to stay around to the end. There are a couple more questions, but I'm trying to keep to our schedule this morning. So we'll perhaps revisit those questions at the end. But Jan, thank you so much for your enlightening, if depressing, talk this morning.
Very sorry about that.
And just want to wish you all the best. You know, you're doing an absolutely brilliant job on behalf of all of us, and we appreciate it. I hope you get appreciation sent your way quite often. So
yeah,
thank you very much.
Thank you as well for continuing to support the MPC, because without people like yourselves, you know, it's not about us, it's about the people, you know. So thank you very much for continuing to support us. Speak to you later.
Thank you, and we'll speak to you later. Yeah, thank you. So we move on, and now I'd like to welcome Deborah McBeal, who, as I said earlier, is Enfield Director of Integration for the NHS Central London Clinical Commissioning Group. And Deborah is going to talk to us. You're familiar with Deborah, who's attended our meetings in the past. So welcome, Deborah. It's lovely to have you with us. Recent changes within the NHS and their potential impact. Right, off you go.
So thank you, Christine, and thank you everyone for inviting me to speak at the Older People's Partnership Board. So I just wanted to say that I'm having a number of IT issues, so hopefully you can hear me okay and you can see me. I've got 2 laptops on the go because I couldn't use my work laptop, so I've got my personal laptop going. And we did do some slides, but I'm not sure whether or not you've got them either to share with people afterwards. I can talk through, you don't necessarily have to see them at this moment in time. I would share them if I could, but my personal laptop unfortunately doesn't allow me to do that, and I can't get into Zoom on my work laptop. So we can share them, and potentially you could distribute them around to people after the meeting, if that's okay.
I think that will be fine, Deborah. Thank you.
Great. Thank you. And if anyone can't hear me, then just let me know, but hopefully it seems to be working okay. And sorry, because of that, I did join and I didn't actually hear Jon's start to the meeting, but it was really helpful to hear what Jan had to say. Equally difficult messages. So for Enfield and for the NHS, I know you wanted us to talk about the future changes or what's happening in the NHS at the moment. I will then try to answer as many questions as I can. And I'm joined as well by a colleague who you will all know, Laura Andrews. So if there is anything that we can't respond to, then we will capture the question and we will come back to you with an answer. Is that okay? So the NHS,
yeah.
Thank you. So the NHS in Enfield and across North Central London. So what is it that we want to do for the older people across Enfield? So we want to support older people to live healthy and long lives. And we see this forum as a key stakeholder, and we really want to hear your views, take on board feedback, and then be able to respond accordingly. So part of that rationale is clearly health spending perspective, means that it's better for the NHS from a spending perspective and the pounds that we spend in Enfield, and for all of our older people residents, that we keep everybody in better health, so that therefore we're not spending significant amounts of money having people going into hospital and needing emergency care. So we know that it's much better to be proactive, looking after people, intervening earlier, and making sure we are supporting people to live healthy and longer lives. So if I talk to you a bit about what we're currently doing across the NHS. So everybody, I'm sure, will have heard that there's an NHS long-term plan. That was published early in 2019, so a good 18 months ago now. That set a direction of travel for organisations to work in an integrated local health and care system. So the rationale for that is that you would have health and social care working together in order to keep residents healthy, fit, well and active. And the plan for the NHS is that we would have one strategic commissioning organisation at the heart of it. So previous to April, Enfield was its own CCG. We had Enfield Clinical Commissioning Group. However, in April 2020, we brought together the 5 North Central London boroughs. So we now work much more closely and in partnership with our colleagues across Barnet, Camden, Haringey and Islington. So we're a clinically led and member-driven organisation, which is made up of the 200 GP practices across North Central London. And each year, what we do is we commission services, so we buy healthcare services based on the needs of the people living in the boroughs. And the services include hospitals, primary care, which is GP practices, community and mental health services for adults and children, as well as a range of other health and care services. But we don't commission everything across the NHS. NHS England is an organisation that, for example, commissions pharmacists, dentists, optometrists, and they commission some of the more specialist healthcare services that would be seen to be the more specialist areas of, for example, services that it makes sense that are commissioned across a much wider footprint. And what we do is we want to shape our plans by listening to people who use the services we commission. And as well as that, listen to the many dedicated professionals who work to deliver them. So we think that key partnership with yourselves and across the wider Enfield footprint. So we link in with a significant number of stakeholder organisations in order to make sure that we are responding, listening and responding to what people are telling us. So we now have a single CCG across North Central London with a single governance structure. So we have a single governing body, which is made up in the majority of GPs from across the 5 boroughs to ensure that it is clinically led. And we have a number of committees that ensure that we look at including patients and the public, but we also are able to do our business. So we have a patient and public engagement and equalities committee, and that is made up of stakeholders from across the 5 boroughs. And we went through a recruitment exercise in order to make sure that we recruited across all the 5 boroughs. But that isn't just what we will do, because clearly sitting here and speaking to you, and then the work that is taking place through the Integrated Care Partnership, means that we have other opportunities to engage with residents as well. So the main focus of what we want to do in Enfield, and that the NCL-CCG has agreed to do, is to improve outcomes by tackling inequalities. And we know that Enfield has significant inequalities, and we know that there is a significant gap generally determined by whether or not you live in the west or the east of the borough. And our goal is to help all of our residents to start, live and age well in North Central London. And clearly, speaking to the older people's partnership board, this is around living and ageing well in North Central London, and to ensure that we deliver the best possible health outcomes. And we have recently made some real progress in recent years, but we know that we have a lot more to do, especially now that COVID has raised and hit us, and we know that that has amplified the inequalities. And that is something that we're currently looking at addressing. And so in Enfield and across the whole of North Central London, each of the boroughs, so for Enfield, we have set up an integrated care partnership board meeting and an integrated care partnership plan. So probably is a good opportunity for me now to talk about the Enfield Integrated Care Partnership Plan that we have agreed. So back in June and July, we brought together a significant number of stakeholders across Enfield, providers, commissioners, a number of community and voluntary sector organisations, in order to bring all the voices together to start to work through what is it important for Enfield that we deliver under that plan. And within those two workshops, we ensured that there was independent facilitation so that everybody's voices could be heard, and that we could take on board all of the feedback and concerns that people were raising. And part of doing that piece of work if we can get a plan that is agreed by this significant number of stakeholders across Enfield, that we would have a much better chance of that we could deliver something that everybody could corral behind and help all of us to deliver. So we know that how we've previously worked as organisations, it hasn't really talked to the heart of what residents have been telling us and what they think is important. And when we worked through what was required, there were 3 initiatives that came out of the workshops that everybody agreed that we should focus on. So not surprisingly, the first one was to identify and address health and wellbeing inequalities, specifically in our BAME communities, so our Black, Asian and minority ethnic groups. And we know that COVID has significantly adversely impacted those groups. So we've already got a lot of information in order for us to start to agree what it is that we want to deliver to address that. For the second initiative, it was recognised and agreed that we should absolutely achieve all the targets of the uptake of screening and immunisations for our residents. And for Enfield, we've already started a great piece of work that we've had all stakeholders working together to deliver on our flu vaccination programme, and I'll come back to that in a moment. And then the final initiative is driving a greater focus on improving mental health and wellbeing amongst our residents. Now, there were initially 12 focus areas, so there was a big long list. But what we've agreed is that we will focus on delivering the 3 initiatives in the first instance. Once we have made progress and delivered those programs, we will then start to look at the other areas that came out of a longer list. So we won't stop at just the 3, but clearly it's important that we focus on something in the first instance. And that what we're currently doing is setting up those task and finish groups. We already have the task and finish group set up for the flu vaccination programme. And if I talk to you briefly about that, because it's really, really important this year, in light of COVID, that we absolutely vaccinate as many at-risk groups who are eligible to have the flu vaccination as possible. And that includes everyone that is aged 65 years and over, and everybody who is under 65 years of age but who has a medical condition, everyone living in a residential nursing home, everyone who cares for an older or disabled person, and household contacts of anyone on the NHS shielded patient list. Now, in addition to that, this year, the government has also agreed that patients who are over 50 should also have the vaccination. And the request at this moment in time is that patients wait to be invited for their flu vaccination, because the GPs and the organisations that are delivering it are ensuring that they deliver it on a risk-based process in the first instance. And we are also in the process of receiving the vaccinations for the patients who are over 50. And we really want to vaccinate those patients, but we need to prioritise the at-risk patients first. So if you are somebody that is over 50, but you aren't someone that has a medical condition, so you're not in the at-risk group, we are asking those residents and patients if they can wait to be called, because you are important, but it is important that we have the opportunity to vaccinate the at-risk people first. And there's been a lot of work that has taken place, including a video that has been shared that helps to reassure residents about the vaccination. And also we're aware that there's an anti-vax group, and we want to make sure that people are getting the scientific information behind it to understand why it is important. So that was the main thing that I wanted to talk about flu. And within the organisation and across all the stakeholders, we've got a fortnightly meeting. We are tracking uptake of the vaccination, and where we are seeing that the achievement isn't being achieved, so where the uptake isn't being achieved, we will be taking corrective action in liaison with all stakeholders to work out what is it that we can do to improve that uptake. Really, really important this year. And just to, I won't talk anymore other than to say I have got some Enfield good news. So we commenced an atrial fibrillation anticoagulation programme recently. And I can confirm that we are the best performing CCG for delivering anticoagulation to our patients who have atrial fibrillation across both North Central London and North East London. And we are higher than the average for Northwest, Southwest and Southeast London. And we've also improved our prevalence, which means we've identified more patients who need to be treated. And we're now starting to see equally impressive results with diabetes, the 3 treatment targets. And that's really good news for our residents, because it means we're identifying patients and we are treating those patients, and that's really important because that will help all of our residents live healthier and longer lives as well. So I'll pause there.
Thank you, Deborah. There were a couple of moments where we lost you, but I think that everything, no, don't worry, but there was only a couple of times where you froze a bit, but it's been fine. Thank you very much indeed. Very informative. Again, I would ask people for questions. I'm sure Deborah has only given us a small taste of her work, which is pretty extensive. And so we've got one question already, Deborah. Why were Enfield residents not publicly informed about the older people's unit being moved from Chase Farm Hospital to Barnet Hospital?
So there is an internal committee, which is the Clinical Advisory Group across North Central London. So part of the response to COVID, as I understand it, is that there was internal work taking place across the NHS to protect residents across the whole of the NHS, but for us across North Central London. So what happened in relation to that is that there will have been discussions that would have taken place within the organisations, so the hospitals, to work through how best to make sure that we could see COVID positive patients or patients that potentially did have COVID, but also to try to protect patients who don't have it from catching it. And part of the rationale around the movement of services was to ensure that we could protect not just the residents, but also the healthcare professionals that are delivering the services. So as I understand it, there was a request made to do that, and that was agreed by the Clinical Advisory Group because they would be taking into account all of the clinical expertise, taking on board what public health are advising regarding the COVID, the virus, and then trying to ensure that services were placed in a position that would protect the population as best as they could. So it's not an ideal situation. I know that, for example, the Chase Farm Hospital site is trying to restore elective and planned activity. Clearly, if they're taking patients who potentially have COVID, then that isn't good because obviously it spreads so virulently that it's really difficult to contain it if you get one person that has it. I don't know what the future plans are for it, but we are in liaison with all of the organisations to try to get services restored as quickly as possible. Because clearly there is now a backlog of activity that is taking place, and we know that there's another spike occurring. Figures have started to increase again. We know that there is the potential that some areas may potentially have to go down into lockdown again. It's been really, what's the best word I can say? It's been really sort of difficult to ensure that we are making absolutely the best decisions given the circumstances, but I can guarantee you that all the healthcare professionals and all the clinicians are taking advice on careful consideration and trying to make the best decisions for all of our residents. I don't know whether that really answers your question.
Well, there is a follow-up to that question, which is, doesn't answer why we were not told, and the difficulty of Enfield residents getting to Barnet. And it's in the question, it says on the Royal Free website, I'm reading this,
Yep.
on the Barnet webpage, they're celebrating this unit having completed its first year as if the unit had not been going for a number of years at Chase Farm.
Right.
Do you want to come back on that? Or
I haven't seen that, but I can take it back as feedback. Yes.
Thank you.
And
Thank you very much.
very, very happy to also take back to find out what the future plans are as part of restoring normal services. But there is this element around restoring services in the light of COVID being around for the longer term.
Yeah.
And again, there's careful discussions that are taking place in order to make sure that we are protecting our residents as far as possible. And we know that there has been a significant impact on healthcare professionals as well. So it can be passed very rapidly between healthcare professionals, and clearly that is an issue that we need to keep under careful consideration as well.
Thank you. I think from other questions that are coming up, it would be great if you could get back to us on that. And
I will do.
Information.
Yeah.
Thank you. Got one last question for you within the timescale that we've got, Deborah, and that's what is happening to a feasibility study regarding integrated multipurpose health centre to tackle inequality to be set up at North Middlesex Hospital?
Yes, I can answer that. So, yeah. So, a feasibility study has been commissioned, and that is feeding into discussions that are taking place between the provider and commissioners. And that is something that will be actively discussed as part of the integrated care partnership working. So we've got meetings planned and organised. Not surprisingly, you would expect that under those task and finish groups that I talked about, there would be enabler work streams around estates, infrastructure, IT and digital, population health management, and making sure that we are looking at evidence to inform our decisions. But in essence, the answer to that is that it is being discussed as part of the integrated care partnership working, so that we can respond to all stakeholder feedback. And within that stakeholder group, you'll be aware that we have the community and voluntary sector organisations. So we will be taking on board the feedback that we receive, and we're aware of the Poverty Commission report as well. So as part of that feasibility study, there has been note taken of stakeholder feedback and a number of reports, and the history of Enfield as well.
Okay, and just time for one small follow-up on that. Who is carrying out the feasibility study?
So the feasibility study has been commissioned, we've commissioned the feasibility study that has been delivered by GB Partnerships. So they were the organisation that provided the feasibility study that we commissioned last year about at the Chase Farm Hospital.
Thank you. Deborah, thank you very much. I've had quite a few messages on chat saying that people would really like you to send us the slides and any further information you can to, in those questions. We'll probably be able to send you a whole list of questions as well. Is that right, Tony? Yeah. And so hopefully we'll be able to do that for you, and you could get back to us at some point when you find out the answer.
Yes. So if you send them across, then Laura and I will look at them and gather the information and respond.
Right. Deborah, thank you very much. Are you able to stay to the end?
Yes,
just in
I'll
case
stay. Very happy to stay.
That's lovely. Well, thank you so much for enlightening us. And for offering to enlighten us further. We'd be delighted. And so Deborah will stay for the final question and answer session. So we look forward to having some more questions at that point. So thank you very much, Deborah. And our final panelist today is Bindi Nagra, who is Director of Health and Adult Social Care in Enfield. And he's going to talk about health and social care in Enfield, surprisingly, its future and integration issues as well. So Bindi, over to you and welcome.
Hi, thanks Christine, and thank you to the other speakers. I was particularly, I could listen to Jan talk about pensions all day because it's my favourite topic, and so I was really pleased to be able to listen to that, and obviously thank you to Deborah for talking extensively about NHS matters. So what I'm actually going to do, Christine, is to talk about the kind of topical issue of COVID and the kind of the social care response to COVID and how we've supported providers, because I think that's probably the most important way I could spend my time, but I am willing to answer questions at the end on any other matters. So for people that don't know me, my name is Bindi Nagra. I'm the Director of Health and Adult Social Care at Enfield Council. I've been there many years, about 13 years now. It's been several years since I've been to the older to the over 50s forum, I have to say. So it's a delight to be back here. Normally we do this in the council chamber, I know, which is much more exciting, but I'm in my front room now, so we'll try and make it as exciting as possible. I'll wave my hands about as much as I can to get everybody excited. So so in terms of supporting, you know, kind of social care through the COVID period, I guess the first thing to say is that, you know, the staff in the council and adult social care in particular have been working throughout the COVID period. You know, if you're a care worker working in a care home or a domiciliary care setting, you know, unlike lots of people, they're not able to lock down. They have to go out every day. And that has been, you know, exhausting and challenging, and you know, in some cases, and in fact in quite a lot of cases, quite traumatic for some of them in terms of what they've had to deal with. We have in Enfield one of the a very large and diverse provider market, supporting kind of adults and older people with a range of conditions, circumstances and disabilities. So to give you some sense, we've got roughly 79 care homes in Enfield, which means that we've got the second largest number of care homes of any London borough. So Croydon has more than us. Barnet has roughly about the same. I think one home less than us. So we're second highest in terms of the number of care homes. And that means that we've had a particular challenge during this COVID period, because as people will know, sadly, you know, COVID-19 has impacted on care homes, you know, very dramatically. We've lost lots of our residents over the last few months. And, you know, if you are a borough that has that number of care homes, supporting them through this period has been a real challenge. So 79 care homes providing 1,800 bed spaces. In addition to that, we also have a fairly vibrant domiciliary care market and that supports people in their own homes and in supported accommodation. So we've got 70 regulated, CQC regulated care providers in Enfield. Again, that's a huge amount when you compare us with even our neighbouring authorities. And in addition to that, we have 32 day centres. So it's been a mammoth task to support them. We work with probably, so adult social care works with about 10,000 people each year. And that's kind of all age groups up from 18. And we estimate that we work with probably about 10% of people over the age of 65 in the borough. So there's about 45,000 people over the age of 65, and in any one year we'll have contact with about 10% of that group. So what have we done to support care providers? So I guess the first thing to say is PPE was probably the first issue. So national shortages of PPE and care workers not having adequate supply. In Enfield, we're in a fortunate position in that we did have our own, we have our own community equipment service with our own stores, warehouse, and we did have a supply of PPE already. So in the kind of first 3 or 4 months of the COVID pandemic, we were able to deliver 4 million items of PPE to our care providers, some of whom literally, you know, were running out day by day. They were phoning us and asking for our help, and we were, you know, pleased to be able to deliver equipment to them within, you know, a matter of hours in some cases. And we've continued to do that throughout the pandemic period and provide that PPE free of charge. In addition, we've also given them some money for emergency PPE, and we did that back at the end of March as our initial response. So you kind of get some sense that we were you know, in a good position already, and we were able to respond quickly. We also, so a big issue for us during the pandemic has been the ability of relatives and carers to kind of communicate with people who have been in care homes or in isolation in their own homes. So one of the things that we've done is that we've been distributing free tablet devices to people. So all of our care providers have had free tablets device, and we've supported, you know, families and staff to maintain contact and access through kind of online training and webinars, but also through these individual devices, which I think, you know, it comes to the issue of kind of social isolation and how do you support people when they can't get out and about. We've also been issuing free of charge to all of our providers what we call vital signs equipment. So recognising that lots of people are not able necessarily to get to their GP, or nurses not always able to come out. So we've been issuing equipment of what we call vital signs equipment and training to all of our providers to support with regular monitoring of things like temperature, blood pressure, blood oxygen saturation levels, which are all provide kind of early warning signs that people might not be very well and need further medical intervention. In addition to that, where we've been providing kind of equipment to support carers in things like kind of manual handling, especially when there's kind of, you know, reduced the number of carers because of a need to manage infection control. We have increased the amount of money that we paid providers. So in April and May, we paid all of our providers an additional 5% on top of what they were currently being paid, recognising that, you know, that some providers were going to struggle financially with the additional costs. And then we've also done things like, so we've worked with an online portal called Proud to Care for recruitment. So it's definitely a site that people should have a look at if they know people who want to get into the care sector. So the Proud to Care portal is a portal that we developed across North Central London to support people who wanted jobs in social care. So there are huge numbers of jobs being advertised via that route. And then in addition to that, we also recognised that many carers were going to be suffering, you know, distress, anxiety, concern both about their own personal circumstances during this period, but also their work circumstances. So we introduced the Employee Assistance Programme. So all care workers, again, not just those directly employed by the council, but those working in agencies, in residential nursing home cares, now have access to the council's Employee Assistance Programme. And this is a primarily it's a telephone service, so people can phone, get advice, you know, kind of high-level legal advice about, you know, if people are having financial difficulties, if carers are having financial difficulties, but also if people are suffering stress and need, you know, counselling, you know, especially if you've worked in a home where there's been a number of deaths as a result of COVID, you might want to have somebody to talk to. So there is a counselling service that is available through the Employee Assistance Programme. And we did that really early on in the pandemic. So I think we introduced that in April. And that's proved really successful at supporting people. Testing, I guess, is one area that people might want to have some interest in. So we, like lots of places, have struggled to get sufficient testing for care staff, and certainly in the early days that was really problematic. At the moment, so the government back in kind of June said that by July all care homes would have testing on a 28-day basis for residents and a weekly basis for all staff. Our current estimates, and we've been phoning the care homes, well, certainly in the first 3 months, we were phoning all of the care homes every day to check on their welfare and to get information from them. But our current estimates are that probably the testing regime promised by the government is probably only achieving 70% of what was expected. So not all care homes are getting the 28-day testing for residents and the 7-day testing for staff. And we know that when homes in particular are getting the tests, that sometimes the results are taking, you know, more than, you know, 48 hours to come back. And obviously if you've got somebody that's asymptomatic, you know, waiting a week for a test result to come back is really problematic. So we're continuing to work really hard on pushing to get, you know, the testing up to 100%. I mean, all care homes have had testing now, and all staff have been tested, but getting the routine testing is really key to keeping the infection out of the homes. And the other thing that we found problematic in Enfield was that the government targeted testing at care homes, but excluded care homes for people with mental health problems or learning disabilities. So again, the council stepped in. We managed to get swab tests from UCLH. They were kind enough to give us batches of swab tests, and we managed to get a lab locally called the Crick Institute to process those tests. So we started setting up our own test centre for people with learning disabilities and mental health problems, and we've continued to do that, and so we've continued to try and extend the testing that's available. Just moving on, so something's just popped up on my screen. We've been providing providers with regular information. There's huge amounts of information coming from the government around what people should and shouldn't be doing, and trying to interpret that for providers and not just pass on emails and say, here's another bit. You know, we've been trying to work with providers, pick out the bits that are important and that we want them to focus on. We distributed in July, the government gave us a grant of £2.6 million. And as a council, we decided that the right thing to do with that was to pass that straight on to providers to support them with infection control. So that was passed to our care homes and to our domiciliary care agencies to give them that kind of extra boost and support, and to help them, you know. So for things like, you know, what we wanted to do was to support staff in in particular that were maybe had more than one job and were moving between care homes, to try and bring that to an end, so that the money was to be used to actually say to staff, well, actually you can be employed in one setting rather than move about and potentially cross-infect people. So, and it was also to be used to buy equipment if they needed, extra equipment in their facilities or in the domiciliary care agencies. And it's probably worth saying that as a council, we have continued to lobby government on the whole range of issues around COVID, money, access to PPE, access to testing. And, some of you will be aware and will have seen that, the leader, Director of Public Health, and myself have been in regular contact with government departments saying, we need more help, and we'll continue to do that and to advocate for the people of Enfield. So, I mean, I think it's worth saying that this has had a significant impact on care services. So if I go back to March, we have probably had about 62 vacancies in our care homes, and now we've got about 250. So, those homes are going to be, facing some challenges going forward. However, I am pleased to say that we, with the support that we've provided, and with the work that the care providers have done themselves, we've not lost any domiciliary care agencies, and no residential or nursing home care providers have closed during the pandemic at this stage, or as a result of the pandemic, I should say. So that's good news. Obviously, we'll have to see what the next 6 months brings, because potentially, they're still going to be under stress going forward. So just kind of final few points really in terms of what we're doing going forward. So the government have issued fairly detailed guidance about winter planning, and it covers things like, again, movement of staff, PPE testing, seasonal flu vaccinations, the arrangements for discharge from hospital, how we're going to support care homes in terms of additional kind of medical support, and also kind of further access to digital equipment for the care homes and for domiciliary care providers. So I guess that's probably where I'll pause. I mean, I guess people will have lots of questions for me on a whole range of issues. I would just, as this is the Over 50s Forum, encourage everybody to have their flu vaccination when it becomes available for you. It is going to be really important, more important than ever. And if there are any people that have kind of phobias to these things, then let's have the discussion and see if we can help. Thank you, Christine.
Thank you very much, Bindi. Need to speak to my GP again about having my flu jab, because they ain't got the supplies, they tell me.
No, but they could probably book you in for end of October, early November. It's not about a lack of supplies. It's more a logistical issue, because we're asking the GPs to vaccinate, significantly more people than they've ever done before. And so the focus has been on people over the age of 65 with comorbidity type issues. The under 50s are having to wait a bit longer, and I've booked myself in for flu vaccination, and it's been moved to the end of October. But you've got to bear in mind that some of our practice don't have the storage capacity to store large amounts. They need fridges, so they're getting them in. They're giving people the vaccines, and then they need to get more in. But it's a logistics issue rather than a lack of will or a lack of vaccine. And some people have asked me, I've had a number of queries about whether there is a shortage of vaccines, and I have checked and rechecked with Department of Health through the Director of Public Health, and I am assured that the issue is not a lack of vaccines. It's about timing and it's about logistics. And people won't be aware of this, but there's actually 8 vaccines. There's not one vaccine this year, and those 8 vaccines are for different people. So there are vaccines for children, there are vaccines for people under the age of 50, and then there are vaccines for people over the age of 65. So it is a logistics issue rather than a lack of vaccine, is my understanding. That might change, but that's my understanding. Those are the assurances I've been given.
Thank you very much, Bindi. Thank you very much for a very interesting exploration of care homes. I do have a couple of questions. One, hold on, how many care homes are run by private organisations? Well, Jon Newton has kindly answered that and said only one is a council care home. But do care homes have to have an infections policy for CQC registration? And does that mean they should have a certain level of PPE and have their own suppliers? You've talked about supplying.
So yes is the answer. So under normal circumstances, care homes would have an infection control policy, and they would have to provide their own PPE. But obviously the level that they would do that at it would be completely different to the circumstances we currently face. So part of our work with care homes has been making sure that they have policies that are appropriate for this pandemic. And of course, we've been making sure that they have the appropriate PPE and also testing, because, you know, things like wearing some of these masks, you actually have to be trained to fit them. They're not, you know, the medical grade of mask isn't one you just put on your face and hope for the best. They actually have to be what we call fit tested. And so workers understand how to get a seal. So we've been doing all of that work with care homes, and we'll continue to do that. But yes, they are required to have infection control policies as standard, and they are required to have a level of PPE as standard. But obviously we've ramped that up over the last 6 months.
Thanks, Bindi. And another question, which is how much has the council spent on helping residents in the private care sector? Have a clue?
So the council's overall kind of COVID expenditure is about £65 million. A significant proportion of that is related to loss of income, and that ranges from, you know, people who have lost their jobs and needing support with council tax, but also, you know, things like loss of parking income, for example, where we've got, you know, commercial facilities, theatres, things like that. You know, obviously we've not been getting the income, so a significant proportion of the income has been related to that. So that's, you know, 65 million in total. In terms of adult social care, we've been, you know, we set a budget at the beginning of the year of about £8 million additional spend on COVID issues, and our current forecasts are that we'll spend all of that this year. So we've spent about 8 million, and then that doesn't include the money that we've given to care providers, and you know, so that's in addition to that. So we'll probably end up having spent an additional, just in adult social care, an additional £10 million.
Thank you. And one other question for you: can Enfield expand the testing scheme it's got with the help of public health team and ask for government money?
So we are doing everything we can to encourage more testing in Enfield. We put in a lot of effort. So originally the test site that was in Enfield was the Lee Valley test site, which effectively was a regional test site. And we put in a huge amount of effort working with the military, because they were managing the logistics to get a walk-in test site at Edmonton, We've now got several other, and there was also a site at Chase Farm. We've now got several other sites in Enfield. In addition to that, I mean, I've said that the council set up its own testing site for people with learning disabilities and mental health problems. We're now in talks with the NHS about whether we can work together to provide more testing, and potentially using some council staff to support that. And we're certainly trying to work out the best way to do that. In terms of money, what can I say? The government at the beginning of this said money was no object. This council has been left with a huge debt as a result of COVID. It's absolutely right that we spend the money to look after the residents of Enfield, but and we will continue to ask them for the government to fund what we've done. But at the moment, there looks to be a big hole in what we've had to spend and what we've received from government.
Sorry, I left myself on mute. Thanks very much, Bindi. As far as I can see, there are no other direct questions for you. But there are one or two other questions that I've been sort of trying to locate for generally for other panelists. So I'd like to thank you very much, Bindi, for giving us a sort of perspective on local issues, which is really important. And I agree with you, it would be much better if we could all meet in the council chamber, but hey, maybe next year we'll manage that one.
Yeah, and please do invite me, Christine, because I think
we will.
Yeah. Good.
It's a promise. We will.
Thank you.
So if I could now invite everyone to join the panel again. Jon's joined us, and Bindi's here, and Jan has joined us. And Deborah, are you able to, or are you still having a few technical issues there? Oh, well done. Great. That's good.
I'm here.
Well done. That's brilliant. Okay, so I have got a couple of questions which were put on the chat earlier, which we didn't get round to. And if anybody has got any further questions, just add them to the bottom of the chat. So first of all, a question for Jan, which was, do you see in the future other benefits, for example, the Freedom Pass and other transport benefits, but benefits in generally being withdrawn from older people?
Yeah, the answer is yes. I don't know if people remember last year, Lord True and his committee produced a report called Intergenerational Unfairness. Yeah, the MPC did a very, very critical and long response to that report, which I know was circulated, but if people would like it again, if you just ask, I'll get Jonathan, our information officer, to send it out again. And the crux of that report, which we challenged, was that, again, pensioner benefits, that they call them, which we prefer to call pensioner entitlements, because they are there to supplement the most inadequate basic state pension, in the economic developed world. We are entitled to those by government who recognise that we don't have enough money in the basic state pension to keep our heads above water. The fact that they consistently refuse to talk to us about defining a decent state pension and working towards a decent state pension for all, like the policy that I said in my speech, it defies us. This government is going to be difficult to challenge because it doesn't listen, it doesn't respond. However, Lord True and his committee looked at the increasing retirement age, which is why we're arguing against the retirement age being brought forward to 68. And in his report, he said that things like the bus pass the winter fuel allowance, the TV licence, yeah, should not be given on retirement age. You should wait 5 years. So anyone retiring at the age of 68 would be 72 before they got the bus pass, the winter fuel allowance and a free TV licence. And at that time, the TV licence was just coming under threat. So you can see that already the issue for us is that they are being targeted, and they are being targeted on a regular basis by think tanks, economists, all those people. I regularly now have a little spot on the Times economic page, which is an absolute, you know, I don't know how I managed it, but God, you know, thank you, because the Times have been very, very good in doing articles from people like myself, doing interviews, and then taking a poll from their readers. And once readers understand the two differences between the two, you know, there are two schemes and the differences between them, they actually come out with us and say, why can't all pensioners be paid the same? Yeah. So we know that out there, the public are interested in that. It's how we engage. If you know, we write regularly, we email regularly, we get MPs to ask questions regularly. We never get a response from ministers. Shadow ministers are very good about responding, but you know, the ministers we write to, Theresa Coffey, Matt Hancock, all of those, Rishi Sunak, never ever respond to us. Yeah. So it's a very big challenge for us to even get heard. So this is why we need the maximum amount of people behind us, and not just from the MPC, but from other organisations as well. So yes, there is every reason to think that if people look at Lord True's report in a couple of years' time, they will look at that as a good way of saving money. However, what we did say in our response to Lord True is that the £160 billion that pensioners are still giving by indirect taxes, like their income tax, their, you know, because pensioners do pay tax, and through indirect taxes like their council tax, VAT, all of that, through giving childcare for free to allow members of their families to go out and work, and them actually paying their tax and NI, through unpaid caring. Unpaid carers are over 65. There are about 12 million of them at the moment, and they don't get a penny because they've got a basic state pension. To me, you are looking after someone. You're entitled to a carer's allowance, no matter what your income is. So that's another argument we've got. So we put all that in and said, you know, if you're looking at, you know, talking about wealthy pensioners, I've not even had, even though I've asked, a definition of what a wealthy pensioner is. So I decided for myself that it would be those pensioners that pay the higher level of income tax, even though they're retired. We did a bit of research, and there's between 200 and 250,000 of them. Yeah. So if you look at saving money through just taking out wealthy pensioners, it's not going to save you a lot. So it's always the case that the majority of population is the people that they want to try and take money from. So there will be an attack. We expect it. We expect to see lots more in the press. We will continue to argue our corner. But for people, ordinary pensioners out there, write to your MPs and tell them to start standing up for pensioners in Parliament and put in the facts. Right, if they contact us, we can give them the whole, you know, end of what their what the percentage is, what the figures are, and we can provide them with, you know, something to speak from. But it's about time MPs started to stand up for older people. You know, we were them. You know, the younger age group today, when I see them, I say, well, you know, I used to be you. Be in the future. It's never too soon to talk about pensions. And younger people are getting the gist of it now. We do get a lot of support through our Uniting the Generations. But yeah, we can expect more and we have to be ready for it. So, you know, we're relying on all our affiliated groups, plus their families, plus anyone else you know, if you put a petition out there, to get it signed and get it debated in Parliament, because they just don't want to listen. Older people are seen as a nuisance, are seen as, you know, the dialogue and the descriptions that older people have now are a lot worse than they used to be. And in my talk with Tim Davey, I'll be taking to task the fact that the BBC left out of its equality and diversity statement age as one of the characteristics as part of the Equality, you know, 2010 Act. I've given him the option to say it was a mistake and put it right, but I've not had a reply. So when we meet him on the 21st of October, he will get those questions. To Helen, who asked me how much it costs to join the NPC, I have replied privately, so I hope she's got that message. And it is a message that I do believe Enfield Forum is affiliated to the London Region NPC. And if you are, and Helen is a member of your forum, then she's already a member. If not, she has a choice to join your forum and become a member, or she can pay £10 to us to be a member individually each year. So that's that.
Thank you, Jan. Thanks very much. Very
one question.
Thank you.
Did anybody get the quote?
I haven't looked at it. Go on.
Right, I'll give you the answer. And
oh yes, of course.
You know, there is nothing government can give you that it hasn't taken from you already. Yeah, Winston Churchill. Now, when you think of how long ago he was a politician, and things just don't change, do they?
Oh, thank you. Thank you, Jan.
Thank you, Christine.
I have a question for Deborah. Why are the NCL CCG meetings now unavailable to the public as they once were? I know they're available to listen to afterwards, but why not at the time? The public feels more and more cut off from health decisions now that local representation and influence are so much reduced. So that's for Deborah.
So the CCG, so Enfield has come together with the 4 boroughs across North Central London. So it's a single North Central London CCG. So the board meetings are still held in public but remotely, as was the AGM. So there was an annual general meeting as well that took place again in public. I think what some people might be referring to is that the IT doesn't allow just an indeterminate number of people to join. And I think therefore what happens is, unless you're in that first however many hundred are able to join, you then end up not being able to join because there's too many people, because the IT doesn't support indeterminate numbers. And so therefore people then get offered the recording afterwards.
Okay, thank you, Deborah. Right, I've got a couple more questions here. Sorry, I'll try and look at, apparently some people are putting questions in different places. Right, okay. Bindi, a question for you, please. What is the proportion of care home occupants that come from outside of the borough of Enfield?
So I'll talk pre-COVID, because obviously, you know, the figures may have changed, but we used to assume, you know, I say assume based on some evidence that that 1/3 of residents in Enfield care homes were funded by the council, 1/3 were self-funding residents, and 1/3 were residents who had come from out of borough. So that was basically the split, a third, and a third, as just approximations. Obviously, in different care homes, it will be slightly different, but overall, all of our planning assumptions were based on a third, and a third.
Thank you. Thank you. A question here. I was told that the shingles jab gives some protection with regards to COVID-19. Is this true?
So I'm probably the least qualified person to answer this, but as I've health in my title, I should probably give it a go. So I've not heard that. However, you know, it's important to understand that you know, COVID-19 affects people who have underlying conditions. So actually, the more that you can keep yourself healthy and free of any disease, infection or condition, the better. So I would absolutely encourage people, if you're eligible and it's clinically appropriate, have whatever vaccines or immunizations you need to keep yourself as healthy as possible. Unless somebody else, I mean, Deborah or John, know differently, I've not heard about a direct link, but of course there is indirect links, because if somebody has shingles, then goes on to get COVID-19, there is.
People may have seen my screen go blank a minute ago, because I popped out to speak to someone in public health and they'd not heard that was the case.
Okay. Oh, thank you, John. Wow. The word on the web. Brilliant. Thank you. Then another question, which I think is directed towards you, Bindi, is: would you like to say anything about housing, or is that because of housing and poverty? You mentioned the discrepancies in the borough.
So I'm not sure the question was for me, because it came in.
Okay.
It came in at 11:31. So
okay, right. You've seen that one. All right.
But I mean, you know, housing is clearly important. You know, we know it's a clear determinant of you know, lots of other issues in people's lives. You know, people will be aware that the council is doing a lot to try and build new homes at Meridian Water. You know, some people, you know, they're very grand plans, but we are determined to build, you know, 10,000 new properties at Meridian Water. We're also determined to improve council's own stock, so our own stock of council housing. There's a number of regeneration projects to replace some of, you know, the stock that's not very good. Absolutely, it's a you know, if you were to think about all of the things that we could do for people of Enfield, you know, give them a job and give them somewhere decent to live, would probably have the biggest impact on health and their well-being.
Right, thank you very much, Bindi. And a question which Deborah, maybe, is there any hope that A&E will return to Chase Farm?
So no, there isn't. So the Chase Farm Hospital is an elective hospital for planned care. So that is how we want to ideally interact with our residents. So rather than people getting sick and having to go to A&E, that we intervene earlier, that we plan for anything that needs to take place. And that will continue to be the case.
Thank you. So are there any further questions from anybody? I hope I haven't missed anything really crucial. I'm trying to work this.
Gail's put one about the PPE and the private.
John, please.
Yeah, so Gail's put a question on about her plans for 78 private care homes to contribute to the costs. She about the shareholder dividends, the profit levels are lower. So Bindi said, you know, a lot of this, particularly at the start, PPE was a provider issue. Oh, sorry, a supplier issue. So everyone was having difficulty in getting hold of PPE. So they're now trying to concentrate that. So homes will be purchasing their own, but at some point, you know, we have to take joint responsibility for provision of PPE, because the council has, you know, a large stock to support homes with this. Yes, they will do their day-to-day suppliers and contacts and things like that. But it's also true that 78 Park End, a lot of them providers are quite small. So we haven't got, you know, the major players, the HC1s and the Four Seasons, they might have 2 or 3 homes in the borough, but we haven't got, you know, there were about 40 or 45 different providers of care homes in the borough, and some of those are quite small. So yes, they do have profit levels, but then that's how we negotiate and manage the market in terms of what we're prepared to pay for some of the placements. And we spoke a bit earlier about other boroughs looking at placing in Enfield. So we work with other local boroughs to make sure they're all paying similar amounts of money for these places, so we're not overpaying. We work alongside the CCG as well in continuing healthcare to make sure we're doing that. So I know there's a fear that, you know, private providers make a lot of money. Some are, most aren't. Some are just working with us to make sure they're providing a good service.
Thank you. So, any further questions? Have we got?
So Christine, could
Yeah,
I
go ahead.
respond to the query from Irene? So Irene,
Yeah, go ahead. Yeah.
So just to let you know that the patient participation groups, they are still in place. Clearly, with COVID, practices have been focusing on responding to that. I suspect that the PPGs will be reset up remotely. In terms of how that will be done, so we now have primary care networks. So there are 4 primary care networks across Enfield, and they will work with their smaller populations to link in and engage with their residents. So again, they will start to do that as we move in further into recovery.
Thank you very much. Thank you. So I think we've covered everything. I would like to heave a sigh of relief that we've managed this. I'd like to thank very, very much our panelists, Jan and Deborah and Jon and Bindi. Thank you so much for participating with us today. Really appreciated. Thank you all for your questions. I'd also like to add thank yous to Tony and Chris, Tony Watts and Chris Chinnery, who've set this all up and who've worked their socks off over the last period of time to organise this. So guys, thank you very, very much indeed. All I did was have to sit here, which is really great. And I don't like these meetings particularly, but you've made it also very much easier. I miss the heckling and the jeering that goes on in the council chamber. You know, it's much more fun, isn't it? So, but thank you so much. And I don't know whether Tony and Chris are up for doing something again in a few months' time, maybe. Tony, are you leaning forward to say something there?
I'm still here.
I know you are.
Yes, I think we probably will be doing something along these lines. Perhaps we'll find another couple of mugs to run it. They have one of the things we've missed is that we have 3 people that have raised their hand and we can allow them to talk, but a view of the time, I think that we can't really do that. I have to.
I thought the hand raise was cancelled. It is on my screen anyway, so there we are.
Okay.
Right. Okay. Thanks, Tony. Well, once again, thank you, all our panelists. Very, very grateful to you, and thank you, all our attendees. We're really grateful to you too for joining us today. Please let us know what you think. And do get back to us. I know some of our panelists are going to be passing on information which has been requested during the morning, but we really would like to hear from you people who've been sitting there listening and participating in certain ways. We'd like to know what you think, and we really would appreciate your feedback. So many thanks to everybody. And how about that? Look at that. It is 12:28. How perfect is that? Wow. Well done, everybody. Thank you so much.